Welcome to the webinar, Increase Treatment Acceptance with the What, Why, When approach. In this webinar, we will discuss how to put treatment recommendations into a memorable format. What needs to be done? Why is treatment recommended? And when do you recommend that the patient schedules? When patients consistently hear and understand what, why, and when, as it pertains to treatment needs, they are far more likely to schedule. And that is the goal of our webinar, to increase treatment acceptance. My name is Mike Smith, and during this webinar, I will pull from my experience of helping practices increase treatment acceptance. I will also pull from the book I wrote, The Path to Greater Dental Practice Success. Now, I represent Fluence, an innovative dental CPA and consulting firm located in Portland, Oregon. We are proud to be part of the Academy of Dental CPAs, a like-minded group of firms from across the country dedicated to helping dentists. Well, to begin our discussion, we are going to consider the patient's perspective. And to help us do that, we're going to examine a quote from Byron Rivers. For effective communication, think more about how your speech is perceived than in what you're actually saying. To consider the patient's perspective, we need to consider how they are perceiving what is delivered to them in the operatories. When dentists deliver their exam findings and they discuss treatment with patients, a lot of information is relayed. And it's easy to overwhelm patients, especially new patients or patients who have bigger treatment plans. And patients are easily overwhelmed with either clinical terminology or treatment options, too many of them. And it's unfortunate that patients often will leave the chair without clearly understanding what has been proposed or even what the next step is. Now, from a clinical perspective, things may seem just fine. I mean, the patient presents, the doctor makes recommendations based on how the patient presents and what the needs are. The patient's informed about what to do next, and I mean, that pretty well wraps it up. But is that all that is needed? If we're considering the patient's perspective, a lot more is needed. In fact, what we tend to see is that patients leave the operatory confused around three main points. What treatment is needed? Why is treatment needed? And when does the patient need to schedule? Now, as you consider these three main points, I want you to keep in mind that ideally a patient will leave your practice clear on these areas because that patient typically shares information with a loved one after he or she returns home. And that loved one wants to know, what did the dentist say? And you want to make sure that that patient is really clear around these three main points. It starts with what treatment is needed. Since patients are easily overwhelmed with multiple options, and especially when treatment plans get complex, it's so important for you to take them back to being clear about what are their immediate needs. What are their needs in the future? And expressing this in really clear language. And we'll spend time with each of these 3 points. Next, why is treatment needed? Now, clinical phraseology can get in the way of this because we want patients to understand the value and the benefit they're going to receive by having treatment. You never want patients to leave wondering, why did the doctor recommend that I have that type of treatment? Always want that to be clear. And then, what's probably the most important is, when do you want patients to schedule? Creating some level of a time frame for them so that it helps them understand the importance and the urgency to get in the schedule. Because otherwise, patients will go up and create their own timeline, and it may be very different from what you have in mind. Now, as you consider barriers to scheduling, and as you talk to teams about why patients do not schedule, almost always people will say, well, the reason patients are not scheduling is due to cost. And certainly there are some patients who at the current time are not able to have treatment because they just do not have the resources. But the majority of times, patients are able to find the resources. It's just if they're telling you they can't, what they're really saying is, based on what was presented to me in the operatory, I don't see the value. And I have other priorities. I have other places I need to put my resources. And until I understand the value, I'm not going to schedule. So you see, patients usually fail to schedule when they do not understand what treatment is needed, why it's needed, in particular, how they are going to benefit, and when it needs to be scheduled. They don't have an understanding of treatment being a priority. So you see, mastering what, why, and when comes down to knowing how to clearly communicate to patients. And this is so important if you want to increase treatment acceptance that we're going to dig deeper into each of these three main areas. Let's begin our discussion with a hypothetical situation. Let's say that everyone on your team will receive $10,000. If 30 minutes after you finish your exam, that patient can clearly explain what was recommended in terms of treatment. With $10,000 on the line for everyone on your team, how would you approach that exam? Well, my guess is you would first make sure that you were using very clear language when talking to that patient. You would use terms such as crown, filling, root canal, implant. You wouldn't worry about process. You would be very clear about what needed to be done. Next, you would take intraoral photos. You would make sure that patient could see areas of concern. And if the patient was unfamiliar with something such as a root canal or an implant, you may have a model or a graph or something you could show that patient so they could visualize treatment. If this patient had a lot of treatment, let's say they had 3 quadrants of their mouth that needed work, you would make sure in the scenario I outlined that that patient understood what the next steps would be. And then before you left that operatory, you would take time to make sure that patient had every question answered. You would not want there to be any level of confusion. I want you to compare what I just outlined and how you would approach it to your current exam. My guess is that in some cases, you really hit the mark. You do pretty much what I outlined. And in other cases, you fall short. One of the great advantages of having a what, why, when methodology is it makes sure your exams are consistently hitting the mark. The patients consistently leave your operatory fully informed about what they need to do, and they're motivated and guided into your schedule. That's our goal. We will begin our discussion by going deeper into what treatment is it that you recommend? When explaining what treatment is needed, keep in mind, as I mentioned, patients are going to debrief later with a friend or family member. So you want to use easy to understand language. For example, John, the reason your tooth is sensitive and causing you pain is you have an infection. Fortunately, we can take care of that discomfort and remove the infection with a root canal. So I'm very clear about root canal. Or we took an intraoral photo of your upper right bicuspid. You can see the cracks. And that old filling in the dark area you see, that's a cavity. We need to replace this old filling with a new one to protect against further damage. So I'm very clear in this example about the need for a filling. So you need a crown due to the size of the cavity, or a root canal to remove infection, or maybe an implant to replace missing teeth. Now, not only being clear about the treatment, but keep in mind that if you are talking about multiple treatment options, or if you're mixing pending treatment with immediate treatment that can wait, this can be confusing. Let's go outside of dentistry for a moment, and let's say that you're asking for directions. The person not only gives you the directions, but makes commentary about nearby attractions. Now, all of a sudden, it's a whole lot harder to remember the 5 turns you need to make. But if the directions had been just simply given, it would be very clear. And the same thing holds true for you. So you want to keep your recommendations as simple and clear as possible by continuing to reiterate to patients what they need to do next. Let's look at an example. Let's say that the doctor says, Mike, I know we took a lot of intraoral photos. We talked about treatment in 3 different quadrants of your mouth. Let's now talk about what I would like for you to do next. Where I want to start is in the upper left. You have 2 teeth, those 2 molars that need crowns, and you also have a filling in that area. It would be easiest to do them all together if we can do that. So that's what I want you to get scheduled. And then after that visit, we'll talk about what comes next. So you see, in this example, a lot of treatment was discussed, but I came back to what treatment is needed, meaning what is the next step? And I made that very clear. There's also something else that's important to keep in mind as you're discussing what. Well, I want to remind you that when you're talking about what, don't forget about your patients. and your patient's input. You see, your patients may have somewhere else where they want to start regarding treatment. So it's always good to ask. In most cases, patients are going to say, "Doctor, where would you like to start? What do you recommend?" But not always. For example, maybe you have a patient who has a class reunion coming up, and that patient would like to whiten his teeth or have a chip in the front tooth fixed. Well, it gives you an idea of where to start. And as long as that's not going to get in the way of a major issue the patient has, that helps give you direction. And it involves the patient in the conversation. So what is not just about telling patients what to do, but it's about involving them and giving them input. So we've covered what treatment is needed. Let's now turn our discussion to why is treatment needed. Why is it that your patient needs a crown? Why are you recommending a graft or an implant or a bruxism device? Now, while you may communicate the need for each procedure in language that's clinically correct, you may not be answering the why question for patients because patients do not understand the same language that you do. And that's an unfortunate thing because it leads to patients not scheduling. In general, we tend to overestimate our ability to communicate clearly, and we overestimate our ability for patients to understand clinical terminology. But the great news about this is you can shift and fine-tune your treatment presentations. Let's give a couple of examples here. For example, you may tell the patient that she has a gray leaky margin that concerns you about tooth number 3, and that's why she needs a crown. Now, in your mind, that may be clear, and it's real clear in your chart notes. But for your patient, what the patient hears, if we go back to the Byron Rivers quote, and what does your patient perceive? Your patient is hearing that your digital x-ray is showing something. It sounds sort of fancy, but the bottom line is nothing hurts, so why in the world would I schedule? By contrast, if you are communicating in easy to understand language and let the patient know you have a cavity on this tooth, and due to the size of the cavity, we need to replace the old filling. Well, now the patient understands this. They are clearly understanding why. Let me give you a couple of other examples. Let's say you have a patient who has gum disease. Well, instead of using confusing terms such as perio and deep pockets, use easy to understand language. For example, "Mike, based on our findings, you have gum disease." Now, this is a common condition where you have an infection in a place you cannot reach with a toothbrush and floss. But fortunately, we can remove the infection and prevent the disease from causing further damage. Treatment is a two-step process. Or let's say that you have a patient who has a missing tooth and they would like to have that missing tooth replaced. Well, instead of focusing on how an implant is placed, educate the patient about the value of the dental implant. You may say, "Now, Mike, that missing tooth can be replaced with a dental implant." The great thing about implants is that they look and act just like a regular tooth. Now, by replacing your teeth with implants, your adjacent teeth will not shift. You're not going to have any other issues. Now, we could replace this with a bridge, but the challenge will be we'll be replacing that bridge more than likely at least once, probably twice during your lifetime. Whereas implants, they're very long lasting. So in this example, not only did I explain the why, but I built value for the treatment. So I want you to keep in mind that you can build value for treatment by using words such as disease, cavities, infection, function, and comfort. In fact, the use of phraseology to build value is so important. I have a separate webinar just on that, how to use effective phraseology, and it really ties in to being very good at discussing why treatment is needed. Why do people need to move forward with the treatment that you've outlined? Now, pairing your treatment recommendations with an intraoral photo is also critical to drive home this message. Or pairing your recommendation with some type of a visual aid, especially if patients have never had that type of treatment before. So let's go through a few other things to keep in mind with why treatment is needed. Look at discussing how you can eliminate pain, improve aesthetics, help someone with their ability to chew. Of course, treatment, you can remove infection. That's a big one, especially if someone's experiencing some level of discomfort. They tend to really understand at that point how you can help them, but also how you can protect their teeth for the long term. Now, the why is important so that patients understand this, but it's also important because you are competing for discretionary funds. I want you to keep in mind that your patients have a lot of pulls on their discretionary funds. They have certainly family needs. They have expenses related to their home and their car. They have just entertainment, vacation spending. So there are a lot of needs that patients have to have money for. And that includes dental treatment. Now, one of the big advantages that you have is that patients trust you. When you can clearly make them understand how they're going to benefit from treatment, now it makes it much easier for that patient to be able to figure out how they're going to allocate their limited funds for dental treatment. So keep in mind that you have a great ability to influence this because of the trust you've built up with patients. That's why it's so important to be very clear about why treatment is needed. Well, now that we've talked about what treatment is needed and why it's needed, we're going to go to the third bullet point and look at when do you want patients to schedule. Now, not only do patients have many different ways that they need to be able to allocate resources for dental treatment or other types of expenses, but they have a lot of pulls on their time. So they also have limited resources regarding time, just as they do with money. And if you consider the schedule of a busy person for a moment, I mean, they have, again, family activities, they're involved in the community, they're obviously very busy with work, so they're always struggling to find time. That is why when you recommend treatment, even though a patient loves coming in to see you, even though they have complete trust in you, when you tell a busy patient that they have yet another time commitment that they need to put in their schedule, it's understandable they do not just jump up and down about it. So patients are always listening for clues. How urgent is this? How much do I need to schedule this? How urgent is it? Because of those limited resources, both time and money. When you put a time frame around treatment, what that does is it lets patients know, you know what, this is something you need to have done. This is not something to delay and wait on. And that is helpful because now a patient has a way to know how to prioritize this treatment in their very busy schedule. Now, what can be very surprising for dentists and teams is that they can do everything right in terms of discussing what treatment is needed and why it's needed, but then fail to put any kind of time frame around the patient scheduling. Now, certainly if some patients, you let them know anything, they're right up front, basically race up front to get it scheduled. But a lot of people, they're trying to figure out, well, can this wait because I have all these other commitments and limited resources, and without a time frame, they will not schedule. And it can be quite an eye-opening experience. Therefore, if patients do not think or do not hear about a time frame, they may not believe that treatment is truly a priority. We're also going to look at a situation next with patients in pushing back. So we're going to do two things. Let me handle the pushback, and then we'll look at how you can start to frame treatment. So let's say that you've let a patient know that they need to have treatment done and you'd like them to schedule in the next few weeks, but there's a little bit of pushback. Here's how to handle that. Let's say that the doctor says, well, Mike, I recommend that you schedule for those fillings we discussed. You have cavities in each of the teeth, and I do not want those cavities to get worse. When we put in the new fillings, they're going to look great. I recommend you schedule as soon as you can. So recommending you schedule as soon as you can is a way to put a time frame around that. Now, let's say that I push back. I say, but doctor, can't the fillings wait? I mean, nothing hurts. What I'm really thinking in my mind is, my gosh, another time commitment, another pull on my resources. I wonder if this is really urgent because I have limited time and money. So that's usually what a patient's saying in a pushback. And so for the doctor in this situation, it's best to stand behind those treatment recommendations and say, Mike, I'm glad nothing hurts. Unfortunately, when your teeth hurt, it means you waited too long. The cavities have progressed, and that means additional treatment and additional costs. And we don't want that to happen. That's why I'd like you to schedule as soon as you can. So let's look at a couple of other examples. So that's how you handle kind of the pushback. And keep in mind that as you recommend treatment and you put time frames around the treatment, you will get some pushback. So when you're recommending treatment and you're letting the patient know when to get scheduled, you may say something such as, John, I recommend you schedule for that crown as soon as possible. Now keep in mind, it's all in how you say it. As soon as possible. I'm very matter of fact. I'm very relaxed. I'm not in any way pushy about that. Or Mary, let's get you scheduled for that night guard in the next few weeks. Or let's get you scheduled in the next month. Whatever rolls off your tongue naturally. That's really what you're doing. In essence, you're letting that person know that this is something that we need to get done sooner rather than later. And when patients push back, Is this really needed? Is this really important? Stand behind your treatment recommendations. Yes, it is. It is really important. It is something for you to do. And keep in mind that you will occasionally have a patient who just can't do it for whatever reason. And that's fine. You've made your point. The patient understands that's a priority, and he or she will get to it as soon as they are able. Third bullet point, when is treatment needed? You want to make sure that's very clear. There's another important point I want to make about what, why, when. This is not just for the clinical team. Ideally, we want to make sure that these important points are conveyed in the handoff from the clinical team to the front team. In particular, the front team needs to always hear, and it's important that it's verbalized, they need to always hear what treatment has been recommended and why was that, or excuse me, what treatment and when do you want that patient to schedule? Those are the two you want to make sure they hear, what and when. What this does is it reinforces the importance of treatment and the need to get that person in to schedule. When what and when are relayed on that handoff, it's much easier for that front team to get patients scheduled. So make sure that these key points are also conveyed from the clinical team to the front team. The final point I want to make about what, why, and when is that it requires teamwork. We can't expect that doctors are always going to remember these key points when emphasizing treatment. So doctors, I encourage you to empower your front or your clinical team that whenever they are unclear about what, why, or when, whenever these points are not emphasized, whenever the clinical team senses the patient might be confused, to ask you, to prompt you about these items. For example, doctor, when would you like Sally to schedule for those extractions? This is a common one. Doctors may remember the what, they're almost always going to remember the what and the when, but they don't always, or the what and why, they may not always understand or remember when. So you need to reiterate, when do you want that patient to schedule? Or sometimes you may notice that the patient, maybe a particular type of treatment was discussed, but you notice that the patient seems confused. So you may say, doctor, what would you like me to list as reasons why Bob needs that night guard? Now the clinical team member knows why the night guard is needed, but you say that just to make sure that that patient clearly understands. So doctors, it's important to empower your clinical teams to ask you about what, why, and when, whenever this is confusing or whenever this is left off, especially the when, the time frame. That's the one that's probably the most common to leave off, but it's so important if you want to guide more patients into your schedule for needed treatment. Well, we've covered a lot of important points. Let's summarize the main ones from this presentation. First, I want you to keep in mind your patients are going to go home and debrief with a loved one about key findings. What is it that you want them to communicate? What is it that you want them to remember? What, why, and when provides a really effective framework to make sure that your treatment recommendations are memorable and to make sure that those recommendations guide patients into your schedule. So start by letting patients know what treatment is recommended in easy to understand language. Next, make sure they understand why that treatment is needed. Remember, the why is communicating the benefits of treatment. How does the patient benefit from receiving that treatment? Then make sure that patients know when to schedule, so it helps them prioritize schedule in their busy lives. Remember, patients have limited time and money. These resources are limited. Therefore, you need to be very effective at why and when so they know how to prioritize your treatment along with everything else they have going on in their lives. And then finally, keep in mind that the clinical team is instrumental in what, why, and when. Doctors are not going to always remember this, so the clinical team needs to prompt them. And the other point on here is make sure that these key pieces of information are relayed to the front team. In particular, what treatment is needed and when you recommend that treatment is scheduled. This will relay the value and relay the sense of urgency from the back to the front. It'll make it so much easier to get those patients into the schedule. Well, I'm excited about the path you're on to increase treatment acceptance. And I encourage you, please let me know how I can be a resource. Please also reference the book I wrote, The Path to Greater Dental Practice Success. The book will be a great resource for you along the way. Keep in mind that it takes time to implement this new framework, what, why, and when. But when you do, what you'll find is that your exams are consistently on the mark. They're consistently ensuring that patients are well informed and they understand the value of the great treatment you provide. By using the what, why, when framework, you will take major steps toward increasing treatment acceptance in your practice.